Glaucoma is commonly recognized as a leading cause of irreversible blindness worldwide. Traditionally, it has been classified as an eye disease, primarily affecting the optic nerve and resulting in gradual vision loss. Most often, glaucoma is associated with increased pressure inside the eye, which can damage the delicate nerve fibers responsible for transmitting visual information to the brain. However, recent research has prompted experts to reconsider this long-held view. Some scientists now question whether glaucoma is truly limited to the eye, or if it might actually be a brain disease in disguise. This emerging perspective challenges us to look beyond the eye itself and consider the broader neurological processes involved. Understanding this shift could have significant implications for how we diagnose and treat glaucoma in the future. Glaucoma is a group of eye conditions that damage the optic nerve, often due to increased pressure within the eye. It is one of the leading causes of irreversible blindness worldwide, affecting millions of people across all age groups, though it is most common in older adults. The disease typically develops slowly and may not present noticeable symptoms until significant vision loss has occurred. Glaucoma can severely impact peripheral vision, making daily activities such as reading, driving, and recognizing faces increasingly difficult. As the condition progresses, it can diminish independence and overall quality of life. Early detection and management are crucial to preserving vision and maintaining well-being. Glaucoma is typically diagnosed through a comprehensive eye examination that includes measuring intraocular pressure, assessing the optic nerve, and testing peripheral vision. Common symptoms of glaucoma may include gradual loss of peripheral vision, eye pain, blurred vision, and, in advanced cases, tunnel vision. However, many forms of glaucoma develop slowly and without noticeable symptoms, making regular eye checkups essential for early detection. Risk factors for glaucoma include age over 60, a family history of the disease, elevated eye pressure, certain medical conditions like diabetes, and being of African, Asian, or Hispanic descent. Early diagnosis is crucial to prevent irreversible vision loss, as damage caused by glaucoma cannot be restored. Eye care professionals use specialized tools and tests to identify signs of glaucoma before symptoms become apparent. The eye is a complex organ composed of several layers and structures that work together to capture and transmit visual information. At the back of the eye lies the retina, which processes light and sends signals through the optic nerve to the brain. The optic nerve itself is a bundle of over 1 million nerve fibers, acting as the main communication pathway between the eye and the visual centers of the brain. In glaucoma, increased pressure within the eye can damage these delicate nerve fibers. Over time, this damage impairs the transmission of visual information, leading to gradual vision loss. The changes often begin at the periphery of vision and can progress unnoticed until significant loss has occurred. Understanding the anatomy of the eye and optic nerve is crucial to recognizing how glaucoma develops and why early detection is important. Glaucoma has long been understood as a disease primarily driven by elevated intraocular pressure, or IOP. This traditional view suggests that when pressure within the eye rises, it can damage the optic nerve, leading to progressive vision loss. For decades, measuring and managing IOP has been the cornerstone of glaucoma diagnosis and treatment. Physicians often focus on lowering eye pressure through medications, laser therapy, or surgery to slow the disease's progression. However, while increased IOP is a major risk factor, it does not account for all cases of glaucoma. Some individuals develop the condition even with normal eye pressure, prompting ongoing research into other contributing factors. Nevertheless, the link between intraocular pressure and optic nerve damage remains a fundamental concept in understanding and managing glaucoma. Recent studies have begun to shed light on the possibility that glaucoma is not just an eye disease, but may also involve neurodegenerative processes similar to those found in brain disorders. Researchers have observed that the loss of retinal ganglion cells in glaucoma shares characteristics with nerve cell degeneration seen in conditions like Alzheimer's and Parkinson's disease. This emerging perspective suggests that glaucoma could be part of a broader spectrum of neurodegenerative diseases. Understanding these connections may open new avenues for treatment, targeting not only the eye, but also the underlying neural pathways. As scientists continue to explore these links, our approach to diagnosing and managing glaucoma may evolve significantly in the coming years. Glaucoma shares several important characteristics with other neurodegenerative diseases, including Alzheimer's and Parkinson's. All these conditions involve the progressive loss of specific types of nerve cells, leading to a gradual decline in function. In glaucoma, the optic nerve is damaged, resulting in vision loss, while Alzheimer's and Parkinson's primarily affect neurons in the brain, impacting memory, movement, and cognition. Researchers have found overlapping mechanisms such as oxidative stress, inflammation, and abnormal protein accumulation that contribute to cell death in these diseases. Understanding these similarities not only helps in identifying common risk factors, but also opens the door to potential shared therapeutic strategies. By studying glaucoma alongside other neurodegenerative disorders, scientists hope to uncover new insights into prevention and treatment. Recent research has revealed that glaucoma is not limited to damaging the eye alone. Evidence now shows that this condition also impacts the brain's visual pathways. Studies using advanced imaging techniques have detected changes in the structure and function of the visual cortex in patients with glaucoma. These alterations suggest that the disease can lead to degeneration beyond the optic nerve, affecting how visual information is processed in the brain. Such findings highlight the importance of viewing glaucoma as a neurodegenerative disorder, rather than solely an eye disease. Understanding this broader impact may help guide more comprehensive approaches to diagnosis and treatment. Adopting this new perspective on glaucoma could significantly reshape both treatment strategies and research priorities. By broadening our understanding of the disease, clinicians may begin to explore therapies that target not only intraocular pressure, but also other contributing factors such as neuroprotection and vascular health. Researchers might shift their focus toward identifying novel biomarkers and mechanisms that underlie glaucoma progression. This approach encourages the development of more personalized treatment plans tailored to the unique needs of each patient. Ultimately, embracing a more comprehensive view of glaucoma holds the promise of improving patient outcomes and accelerating the discovery of innovative therapies. Recognizing glaucoma as a brain disease shifts our understanding of its origins and progression. This perspective highlights the complex relationship between the eye and the brain, emphasizing that damage extends beyond the optic nerve to involve central visual pathways. Such insights open new avenues for early detection, innovative treatments, and improved patient outcomes. Continued research in this area is essential, as it may lead to breakthroughs that transform how glaucoma is diagnosed and managed. By deepening our knowledge, we move closer to preserving vision and enhancing quality of life for those affected by this condition.